The modern doctor's visit often feels like a conveyor belt. You have 5 minutes to explain yourself before you're handed a prescription and ushered out, feeling the most important parts of your story were left on the table. Homeopathy operates on a different timeline. It treats the practitioner as an investigator, whose job is to map out every detail of your health history, from your physical aches to your emotional state. Conventional medicine usually focuses on the diagnosis, the name of the disease. It looks for the symptoms that everyone with that illness has in common. Lasting healing requires looking deeper than a label. Homeopaths search for the symptoms that belong only to you, through a meticulous process called case-taking. This process isn't about categorizing a disease. It is about understanding the individual person who is experiencing the illness. The investigation begins with the doctor acting as an unprejudiced observer. This means they arrive without any preconceived ideas about what is wrong with you, ready to see your case with fresh eyes. During the consultation, the doctor stays mostly silent. They don't interrupt or lead you with suggestive questions. They simply listen as you describe your suffering in your own way. They record your exact descriptions. If you say a pain feels like a cold needle, that specific image is far more valuable to them than a generic medical term like neuralgia. As you talk, they watch for unspoken details, your posture, the way your voice hitches, and the subtle emotions that surface when you discuss your life. This level of attention does more than collect data. It reveals the man in the disease. By acknowledging your internal state so thoroughly, the practitioner creates the foundation for a truly targeted recovery. Within your story, the homeopath is searching for specific markers called the strange, rare, and peculiar symptoms. A common symptom, like a fever, tells the doctor you are ill, but because millions of people experience fever in the same way, it doesn't help identify your specific needs. Curious, however, if that fever makes you crave ice-cold milk or causes your right foot to feel hot while your left foot is freezing, the investigation takes a turn. This sorting process helps differentiate your case. Common symptoms fall through the funnel, while highly unique symptoms get caught, acting like a fingerprint. These specific markers allow the homeopath to bypass thousands of generic remedies, focusing on the few matching your exact pattern. In homeopathy, the oddest details of your experience are the most important pieces of the puzzle. Sometimes the path is obstructed. Years of using various medications can suppress your natural symptoms, leaving the true picture of your illness hidden. People with long-term suffering often stop noticing their own symptoms entirely. They become so used to their condition that they forget to mention details that have been present for years. To clear the air, homeopaths use a historic tool called sack-lac. Sack-lac is simply a placeholder, a pill made of sugar of milk with no active medicine. It allows the doctor to hit the pause button on treatment. This gives the body a chance to clear out the noise of previous treatments. As the effects of old medications fade, the body's true, unmasked symptoms begin to reveal themselves naturally. Sometimes the most effective investigative move is to wait, allowing the true nature of the health problem to emerge on its own. The final step brings every physical, mental, and emotional detail together into a single portrait called the totality of symptoms. The homeopath must then find a match for this portrait among thousands of substances derived from plants, minerals, and the natural world. This requires navigating a massive library of documented effects, searching for the one natural substance producing the exact symptom pattern seen in the patient. They are looking for the similemum, the specific remedy that resonates with your entire state of being. In homeopathy, your individual experience serves as the map. By following the details of your specific story, they find the precise path back to health.